My name is Terry King. I'm the Chief of the Division of Breast Surgery at Brigham and Women's Hospital and Dana-Farber Cancer Center. I'm also the Associate Chair for Multidisciplinary Oncology in the Department of Surgery, and I am the Director of the BPREP program. BPREP is our high-risk program for women who are concerned about their risk of developing breast cancer. There's been a lot of interest lately in identifying patients who may benefit from lesser treatment. So breast cancer has always involved surgery, a consideration of systemic or medical therapy, and a consideration for radiation therapy. But we are really living in an era of a less is more approach, and many of us investigators around the world are trying to identify women who will have excellent outcomes with lesser therapies. One of the most obvious extensions of this theme has been in the management of the lymph nodes under the arm, but this theme has now also extended to identifying women who can avoid radiation therapy after lumpectomy, and in some cases has even extended to identifying women who could avoid surgery altogether. In the studies that have looked at identifying women who can avoid radiation therapy, there are several of these that are ongoing in the US and around the world right now, where molecular assays are being used to study the tumors and to identify tumors that have a very low risk of local recurrence, and therefore the benefit from radiation therapy would be very low in that setting. These studies are aiming to identify women who have such a low risk of local recurrence that they can safely omit radiation therapy without increasing their risks. There's also an interesting ongoing study looking at the omission of surgery for women with low-risk duct carcinoma in situ, or DCIS. DCIS is the earliest form of breast cancer, or some actually call it a precancerous lesion. DCIS is described as the cancer cells still being confined inside the milk duct of the breast. So these cells do not have access to the bloodstream or the lymphatics. It's simply a local problem. We've always treated DCIS with surgery to remove the area of involved milk ducts, and then often followed that with breast radiation to decrease the risk of local recurrence. But we do know that if you took 100 women with DCIS and did nothing but observe them, that a substantial portion of those women would actually never go on to develop invasive breast cancer, that DCIS would remain in their breast and not become a life-threatening cancer. This has led to a lot of attention and investigation to try to identify which women with DCIS could actually be safely observed or safely omit our standard treatments and not experience a negative outcome. There's a large ongoing randomized trial right now called COMET, C-O-M-E-T, that is in fact identifying women with low risk DCIS and randomizing them to watchful waiting, so no treatment at all, versus guideline concordant care. The primary endpoint of this trial is the development of invasive breast cancer at 5 years. So it's a very interesting study because it does aim to identify a group of women who could really avoid surgery altogether. There are some caveats. Of course, this trial is not for everyone, but it is a very adventurous trial, if you will, let me say, because it takes a lot of courage for women to consider no surgical therapy. So we do have to be very careful in our patient selection for this study, and patients need to be well informed that it is a research study and we do not consider omitting surgical therapy as standard care right now for DCIS or for really any early stage breast cancer.